Good evening, everyone. It's an honor and a pleasure to be amongst you all this evening. I'd like to thank Vidant Health Services to have given me this opportunity to be here. This evening, while we celebrate you all and honor your fight of cancer, we also want to refresh our some basic facts regarding breast cancer. Breast cancer continues to be #1 cause of cancer among women in the United States. It's the second leading cause of cancer-related death among women. According to American Society of Cancer, this year around 230,000 new cancer cases are estimated to be diagnosed. 8,000 new cancer cases in North Carolina. The lifetime risk of breast cancer continues to be the same figure as Lynette earlier mentioned, 1 in 8. Over the years, we know multiple factors which have been associated with risk of breast cancer. And they are divided into group which can be modified and a group which cannot be modified. Some of the risk factors which cannot be modified include just the gender and the age. Actually, being a female and as we age, this is the most common risk factor found among patients with breast cancer. Sporadic cancer, that's the cancer which happens because of environmental factors, is the most common cause of breast cancer. But there is 10 to 15% of breast cancer which is associated with mutation in certain genes and which can be passed along different family line. Family members having breast cancer increases your risk of breast cancer. Anyone with a dense breast tissue, which we identify on a mammogram, increases your risk of breast cancer. Anyone having benign breast conditions, multiple biopsies, early initiation of menstruation, late menopause, all these factors increase the risk of breast cancer. And most of these are not modifiable or under our control. But there are certain risk factors which can be modified, like exposure to hormone therapy in postmenopausal women. Having first child before the age of 30 lowers your risk of cancer. Not breastfeeding increases the risk of breast cancer. Being overweight, especially after menopause, increases your risk of breast cancer. Access to alcohol intake, lifestyle, being sedentary, while as unnecessary exposure also has been associated with increased risk. Lately, research also shows that women who work night shift will also have increased risk of cancer. So you can ask for change of shift. What are the signs? The signs and symptoms of breast cancer, luckily, the most common presentation is asymptomatic, but breast lump in the or under the arm can be a sign of breast cancer. Any nipple change, be it bloody discharge from the nipple, a rash around the nipple area, or even an ulceration of the nipple, should be taken seriously. Any skin irritation, which can be thickening, dimpling, or increased skin fold, should be reported to your physician. A warm, red, swollen breast is not normal, especially in patients who are in menopause. Like most breast cancers don't present with pain, but if there is a persistent, unexplained pain, that should be discussed with your physician. As I said, luckily in the United States, majority of the cases are diagnosed when they don't have any symptoms and they're detected by mammogram. So the bottom line is be breast aware, know your breast. Any change, report it to your doctor. Now, if anyone you know has any of these symptoms, what should we do? First thing is don't panic. Majority of the palpable findings which patients present with turn out to be luckily benign. But nonetheless, what is recommended is a thorough examination by a professional. And if you don't have any of these concerning symptoms, but have a family member who has been treated or diagnosed with breast cancer, you may be at an increased risk and should have a discussion with your provider. How do we detect breast cancer? We have an excellent screening tool, mammogram. Dr. Malik is going to talk about it later. The key is finding cancer early. The early we detect cancer, the cure rates are higher, of the order of more than 90%. And how do we treat breast cancer? The treatment is very individualized. While making a treatment recommendation, your doctor takes into account your age, your menopausal status, your stage, and the type of breast cancer you have. Now we know there are more than 7 subtypes of breast cancer. Breast cancer is not a single entity. And often the case is such that patients require more than one modality of treatment. Surgery takes the tumor out of the body, radiation, chemotherapy, or endocrine therapy, as well as targeted agents, are geared towards killing the cancer cells to maximize the chance of cure and lower the risk of cancer coming back. So what does the future of breast cancer look like? The future is bright. While we have made a lot of headway in treating and curing a lot of early breast cancer, there is still work needs to be done because many patients, unfortunately, can have cancer come back. Patients who present early, and the goal, the direction where research is going is that less may be more for many patients. Less surgery, less radiation, and less chemotherapy. Knowing whether you fall in that category, that is a discussion between your physician and you. Breast cancer treatment has been a role model of sorts for many other cancers because it started with breast cancer, where one size fits all no longer holds true, and we have moved from one size fits all to a more personalized and individualized treatment plan. The emphasis also is on less toxic therapies because as many of you have survived the breast cancer, you're dealing with the side effects of the treatment, and we see that it can be very distressing. Nowadays, the ongoing research is that we have to find more precision-based therapy, more targeted therapies, which kill the cancer cell but leave the healthy cells alone. Once a person is diagnosed with cancer, it can be very distressing. But you don't need to lose the sight that it's your body and you need to know the information about your cancer. So we at Leo Jenkins Cancer Center and every physician, I believe, encourages their patient to ask questions. Knowledge is power. If you cannot ask questions, designate a family member who will ask questions on your behalf. Never shy away from asking your doctor to repeat if you didn't understand. The questions which every breast cancer patient should know is what is the type of your breast cancer? What stage you have? What is the prognosis of your cancer? What are the treatment choices? Goals of your treatment. Why is your doctor prescribing this treatment? What are the short-term and long-term effects of your treatment? You deserve to know this. Ask for printed information of the treatment. Take your time to read about them. And last but not least, you also need to ask your doctor, how can you, on your part, modify your lifestyle, change your diet, increase your physical activity to maximize your chances of cure? While the future is great, the future also is great because Vidant Health Center is building a state-of-art cancer center here. We live in an era in the United States, I never thought I'll see patients presenting with locally advanced cancer, but unfortunately that does happen, especially in this area, which is sad. Many patients, for lack of access to health care, they don't present in a timely manner. I want you all to take this opportunity to spread the word. If any one of you are at an age where you require mammogram or have any of these symptoms, please call Vidant Health Cancer Center. Please call any of these numbers. We have 3 grants available at Leo Jenkins Cancer Center in collaboration with Susan Komen. There are resources available. All you need to is encourage your family member, friend. I think that should be your New Year resolution, to go for mammogram or any sign you have, discuss with your family doctor. There is help there. You deserve better. Before I end, I would really want to thank each one of you because you are an inspiration to all of us. I'm speaking on behalf of all the providers. Your courage and determination strives us to do better. Thank you very much. God bless you. Thank you. I'd like to invite my colleague, Dr. Malik. She's going to talk about the role of mammogram in breast cancer. Please welcome Dr. Malik.
Hello, good evening. I agree, it is a sea of pink, a very powerful pink. And I also want to echo my preceding speakers in saying that we thank you all for being here and agree that you are an inspiration to us all. And the reason we go to work every day, and the reason I go to work every day is for early detection. So as Dr. Muzaffar mentioned, mammography is the way for early detection, and we'll be talking a little bit more about that. So early detection saves lives. We know that finding breast cancer early can improve the chances that a breast cancer can be treated and have more treatment options. You can have less extensive surgery and have better treatment outcomes. 98% of the women who are diagnosed in the earliest stages of breast cancer survive the disease, whereas later stages have as low as a 24% chance of survival. Those numbers are large, but the things that you can do to decrease that number are small. Just getting your mammogram every year and presenting when you have signs, like Dr. Muzaffar mentioned. The American Cancer Society recommends breast cancer screening every year before the warning signs are present, and that's when you'll have a chance of being cured. The current recommendations are a mammogram for every woman over the age of 40 every year. That's every single year. That's one time every year, the same time every year. We know you forget, but go ahead and come on in. That's clinical breast exams every 3 years, beginning in your 20s and 30s, and every year once you've turned 40. And it's that monthly self-breast exam, so whether it be in the shower, whether that be when you're laying in bed at night, it's just checking once a month to make sure that there's nothing new. And you'll get to know your breast over time in that way too. And you'll know, oh, I remember that being there last month, or oh, I've always had that area. And that way when your doctor feels something new, you can talk about that as well. So it's very important to start that and to encourage that in any of the female members that you have in your family or at work or your friends. If you're at high risk, it's important to discuss with your doctor the benefit of additional tests, such as MRI, to get along with your mammogram every year. And we'll go over what high risk is. So high-risk women. Well, first, we should talk about what the regular risk is. And as we've mentioned, that's 1 in 8 women, which is approximately 12%. High risk is anyone over 20%. And that means that in the course of their lifetime, there's a greater than 20% chance that they'll develop breast cancer. So who is that? Those are women who have already had breast cancer. So once you've had a breast cancer, you are actually not only at risk for recurrence, but actually at risk for a second area of cancer. It's anyone with 2 first-degree relatives with premenopausal breast cancer. So what does that mean? That means your mother, your sister, your grandmother. And the premenopausal, of course, means before menopause, but we generally like to say anyone younger than 50 in your family. So those ages really are important. Dr. Muzaffar said that age and being a female are your 2 biggest risk factors. So when we get it at a younger age, we really like to pay attention to that family history. Anyone with a known gene mutation. So Angelina Jolie, of course, catapulted the BRCA gene into the media, but there are other genes as well. The BRCA1 and 2 are the most common, and in fact, 20 to 25% of genetic mutation cancers are related to these 2. But as Dr. Muzaffar mentioned, only anywhere between 5 and 15% of any breast cancers are genetic. It's still an important factor. And anyone with a history of chest radiation, so anyone with lymphoma or a thyroid cancer, are at increased risk for the development of cancer, and it actually puts them in that high-risk category. So what are some options then? Well, you might have heard, you might have seen in the news, you might have seen in the paper, 3D mammography. And what is that? 3D mammography, or breast tomosynthesis, in addition to the normal 2D images that you would take, it actually takes a series of images through the breasts in both directions. These images, as that really sciencey picture shows you, instead of just taking that one image from the top that you're used to getting, you actually get a series of images that are taken with just that one compression. And what does that do? Well, I like to say it's like if you had a closed book. If you had the book closed, I can't see what's in between. All I can see is the cover and the back. I don't see any of those words. Well, if you had a flip book, you see that little man moving, right? You see each word or you see each picture. And I kind of like to see that in your breast as well. I don't just want to see the cover. I want to see what's going on in between. And that's what I'm able to see with the tomosynthesis. So here's an example, so we can prove it to ourselves. On the far left or right, as it were, we have a 2D mammogram. That's what you're normally getting every year. It's just that one image. But with the 3D, it's all of those images. And they're all put together to be able to evaluate through the breast. So if there was anything hiding in there, we would be able to uncover it instead of all of your tissue staying right on each other like the cover of a book. So it's greater detail and improved accuracy. It eliminates the overlapping tissue which can mimic breast cancer. So some of you might have been called back. You might have gotten that letter that says, we need you to come back, we saw something on your mammogram. And you come and you get those extra images and they tell you everything's fine. And you ask, well, why did you need me here in the first place? I must have cancer if I was called back. And you're told, no, it was overlapping tissue. Well, this eliminates that. Instead of that tissue overlapping, it's able to spread out from image to image on the tomosynthesis, and it decreases those unnecessary callbacks, which for you, in addition to not having to come back, it also means decreased anxiety. And it also means less unnecessary biopsies and follow-up visits. So may decrease that 6-month visit that you have to come for a couple of years. And I mean, who doesn't want to avoid a needle? I know. That would always be an exciting option. We also know that it actually has an up to 40% increase in the detection of small invasive cancers. So the whole point, right, was that early detection. And if I'm uncovering all that extra tissue, then I'm actually getting to see cancer at an even smaller stage, hopefully and potentially. So it's another great reason to be getting your tomosynthesis. And it's an improved evaluation of that dense breast tissue. So Dr. Muzaffar actually said that dense breast tissue is a risk factor for the development of breast cancer. Well, it also hides breast cancers. We know as physicians that women with dense breast tissue can have difficult to evaluate mammograms. But if you're getting that tomosynthesis, hopefully those extra views can help uncover anything that might otherwise have been hidden by a standard 2D mammogram. So there are several locations across the Eastern North Carolina region, here in Greenville, as well as at the Vidant locations across Eastern North Carolina. And you can find that information on the websites, as well as if you contact some of these vendors that are here afterwards. But I do encourage, if you have any questions, to ask your physician, ask your radiologist, ask someone here, because 3D mammogram could be the best option for you.